Hi there. Welcome back to Children Wisconsin's ongoing live Q&A series. My name is Dustin, and I'm joined by a specialist in our pediatric ear, nose, and throat program at Children's Wisconsin, Dr. Sophie Shay. Dr. Shay and I are here today to answer questions on ear tubes, some other common ear issues, how to help your children combat ear issues, and decide when it's time to see a pediatric ear, nose, and throat specialist for help. We encourage you to leave your questions as a comment, and we'll answer one submitted live at the end of the broadcast. If you're not watching us live, no problem. Leave a comment anyways, and we'll reply to you directly through that method. Dr. Shay, thank you again for joining us today. Let's start by having you introduce yourself and your role here at Children's Wisconsin.
Sure. Thanks, Dustin, and thank you for letting me have this platform to talk about ear tubes in children. I'm Sophie Shay. I'm one of the 10 pediatric otolaryngologists here at Children's Wisconsin. My practice is primarily here in Milwaukee at the main campus, as well as down in Kenosha to serve some of the southeast Wisconsin corridor there. And I joined the practice about 2.5 years ago and had previously been in my training both in Los Angeles as well as Chicago.
Okay, great. Thank you so much. So I'm going to start with a pretty broad question. Why do kids need ear tubes?
So the most common reason why children need ear tubes, or the top two most reasons, are either recurrent ear infections, where they're getting them really frequently, or having fluid behind the ears where they can't clear that fluid. Other reasons for ear tubes may be having constant pressure problems related to the ear or the eardrum. Or hearing issues that have resulted from fluid or infections. Okay.
So what exactly are ear tubes and how do they work to solve those problems?
Sure. So I actually have a little diagram here. I'm going to see if I can hold it up to the camera. So ear tubes are tiny little plastic tubes that go in across the eardrum. So when we make that, when we put in the ear tubes, we make actually a small cut in the eardrum where the ear tube is then put in across the eardrum. And the tube itself is teeny tiny. So I usually compare it to one of those tiny clear earring backings that you can get, but they're teeny. And what they do is they have a small hole in the middle and they go right across the eardrum. And what they do is they help to equalize the pressure in the space outside of the eardrum, or what we consider the outside world, and the space behind the eardrum, or what we call the middle ear space, where that fluid or infection occurs.
Okay. So how would a parent know that their child needs ear tubes? Is it something that they should expect their pediatrician to tell them in a recurring visit? Or would the expectation be for them to bring it up to their children's pediatrician based on conditions they're seeing in their child?
I think that's a great question. I think, the pediatricians in our community are very good at referring children to us for ear tube placement in an appropriate fashion. But certainly, and families want to advocate for their own children, bringing up that conversation with the pediatrician is always reasonable. When we talk about when children should get ear tubes, we're really talking about really frequent ear infections. So that tends to be 3 ear infections within a 6-month period, or 4 within a year. Or if the child has had fluid behind the ears, which is usually just like a mucousy type fluid stuck behind the eardrum, if that fluid's been there on a bunch of different ear exams, or you're suspecting that there's hearing or speech problems, then absolutely it's reasonable to consider talking with one of us about ear tube placement.
Okay, so at what age would a child typically get ear tubes?
So children can get ear tubes throughout childhood. Adults sometimes will need them as well, but the most common or typical age group that gets ear tubes tends to be the 8-month-olds to 3-year-olds. So the peak incidence, if you will, of having ear tube placements around 1 to 2 years of age. And that tends to be because children at that age, they aren't able to clear that fluid or equalize the pressure behind their eardrums as easily as older children or adults. And the reason for that is when we yawn, for instance, or we try to pop our ears when we're on a plane, we're actually opening up the tube that connects the space behind the eardrum to the back of the nose. And little kids, those tubes are just smaller. And that's the eustachian tube. And so in kids, that tube is a little smaller, it's a little more narrow, and it's a little more horizontal. And as the kids' heads and skulls grow, that problem, generally speaking, improves throughout childhood.
Okay. Is it a problem if a child has waited too long to get them? Like, what kind of complications can arise if they don't get them soon enough?
So great question. So if your primary physician or primary care doctor has advised that your child should be evaluated for ear tubes, I think it's important not to wait too long to have that evaluation with us. Children who have chronic fluid behind their ears can suffer from some hearing loss, which can be mild to moderate. And that just means that they can struggle to hear people speak, particularly in noisy environments like classrooms. And that has a lot to do with their speech and academic performance. And so certainly from that hearing aspect alone, it's important. But with recurrent infections, you can get scarring of the eardrum or perforations, which is a small hole in the eardrum, as a result of bad ear infections. And so if a child has already demonstrated that they're getting frequent or recurrent ear infections, it's important to at least consider ear tube placement and see if they'd be a good candidate for that so we can prevent some of those issues.
Okay, that makes sense. So how is our surgical team equipped to care for children with the ear tube procedure across all ages?
So here at Children's Wisconsin, everyone specializes in only children and the care of children. So the surgeons, our group, we're all pediatric otolaryngologists. All we do are take care of children, same as the anesthesia staff. So the anesthesia team, they all only take care of children as well. And so it's important to think of children differently than adults. So kids aren't just little adults, but they have different pathophysiology, different anatomy, different needs medically. And so here at Children's Wisconsin, we're very well equipped from all aspects of surgical care to care for your child in a safe manner. In addition to that, our surgical services include a lot of our nursing staff who take care of children right before surgery and right after surgery. And they're great at making children feel very comfortable with the process as well.
Okay. So where do we typically perform ear tube surgeries?
So ear tube surgeries are done under general anesthesia, which is why it's important that our anesthesiologists are great with our children as well. But the ear tube placement can happen either at the main campus in the operating room here in the main children's hospital or over at the outpatient surgery center. And so the outpatient surgery center is where we do probably the bulk of our ear tube cases. And that's only about 10 minutes south of the main children's hospital near the Milwaukee area. And I like to tell families, unlike the main children's hospital, which has more of a parking garage and like a bigger structure to it, the surgery center is a nice kind of in and out situation for families whose kids are relatively healthy otherwise and just need ear tubes. So it's a nice outpatient setting.
Okay. Can you talk a little bit about, in the midst of the current pandemic, knowing parents might be worried to take their kids in for surgery, can you highlight some of the things that we're doing during this time to keep kids and their families safe?
Yeah, so the safety of our patients, families, and staff are definitely the top priority here at Children's Wisconsin, within pediatric otolaryngology and the institution as a whole. And so we've adopted special cleaning practices, and then you can see that our medical staff during all patient interactions are going to be wearing extra protective gear, such as masks and sometimes even 2 masks to protect the patients as well as the staff. And sometimes we'll have protective gowns and that sort of thing in place to prevent any sort of spread of disease.
Okay.
And then I think Children's has this all posted too. So if you go on the Children's website, there's specifically at childrenswisconsin.org, there's a safety page for that as well that goes into some of the children's practices.
Yep, absolutely. So how long does an ear tubes procedure take? It sounds like it's typically an outpatient procedure. So how long would a parent or caregiver expect to be waiting to take their child home? And how long does it take a child to recover from that surgery?
So my portion of the surgical procedure itself is about 5 minutes, maybe 2.5 per ear. But there's time before and after for general anesthesia. So I usually tell parents to expect their child to be in the operating room for somewhere about 10 to 15 minutes. And then before that time, we do have parents come in about an hour to an hour and a half before surgery is scheduled. And they get instructions for that a few days before the scheduled procedure. So they expect to arrive about an hour and a half before surgery. Their surgery itself would take about 15 minutes in the operating room. And then afterwards, we do want to monitor children, make sure that they're waking up from anesthesia fine and watching them closely, make sure they're eating and drinking before they go home. And so that usually takes about an hour or so after surgery as well.
Okay. So do we use any tools to inform parents before, during, or after surgery?
So we do have, it's an opt-in process, but we do have a patient journey text message notification system where if you were to get scheduled for surgery, you could sign up for it through our surgery schedulers, and then you get text message notifications to walk you through the process and let you know regarding pain management or what to expect after surgery. And then we also hand out instructions that are written at the time of surgery and then also at your consultation visit so that you can review a lot of this material at home. All in all, though, the recovery from ear tube surgery is pretty minimal. Kids are usually kind of back to their normal selves by later that afternoon, if not the next morning, for sure.
Okay. So what should a parent do if they feel like their child might need ear tubes?
I would certainly have that conversation with your pediatrician and talk about, how many ear infections they have or what exactly your concerns are. If they're hearing related, but maybe they don't have fluid behind their ears or haven't had any ear infections, that may be a good reason to have them seen in our clinic or at least by one of our audiologists. And so whatever your concerns may be, absolutely talk to your pediatrician about it, and we'd be happy to be involved in that process.
Okay. So in just a second, we're going to jump into a couple audience questions, but I know you're in one of our exam rooms and have access to show the audience some of the tools we use for those exams. I'm wondering if there's anything in particular you want to highlight here.
So yeah, I just want to turn this camera around a little bit. This is in our treatment room in the clinic. And so sometimes if we have to clean out earwax or take a closer look at your child's ear tubes, we may have your child seen in one of these rooms. But the microscope actually that we have in this room to examine a child's ear in clinic is the exact same microscope that we would use in the operating room as well. So I just thought I'd show it to you guys. But what it is it has two eyepieces here, so we have good depth perception too while we're doing that procedure. And it allows us to zoom in and get, good magnified view of your child's ear while being able to work with both hands. And so that's what the microscope itself looks like. And then the instruments that we use for the procedure. So we always clean out earwax. And so if you can see here, this is just a little spoon or curette that we use to clean out earwax, just so we have a nice clean field in the ear canal to work with. And then we actually put the ear tube in. Once that cut is made, we put the ear tube in by sliding it in with one of these graspers. So I'm going to actually pick up an ear tube here. All right. So this is the grasper that we use. And so if you can see kind of the size of my hand and how small that grasper is. And then the ear tube itself is just this tiny little thing. And so they come in all sorts of different colors and shapes depending on the surgeon or the needs of the child. But they're teeny, teeny, tiny. So if you kind of hold this up to just even the tip of my finger, that's how big an ear tube is.
So how long do they typically stay in a child?
So ear tubes will typically last about 6 months to a year and a half. And that's what I usually say for the kind of first line ear tubes. If your child's a little bit older, has had multiple sets of ear tubes, or has had a lot of chronic ear pressure or fluid problems, we may talk about doing more specialized tubes that last a longer time. That can be anywhere from 2 to 3 years to 5 to 10 years. But the ones that we primarily put in for recurrent ear infections, particularly in the younger kids, will last about 6 months to a year and a half. And they usually fall out on their own sometime during that time period. And when it falls out, I will say that the eardrum will heal behind it about 99% of the time.
Okay. So we've got a couple questions here that I'll put up on the screen. And to let anybody that's watching know, even if you're not watching us live, please leave your questions in the comments and we'll respond to them there. So let's see what we've got. First question, Can ear tubes fall out, which you just talked about? If so, what can you do to keep them from falling out?
So once they're in, they're going to just fall out naturally. So I wouldn't be too concerned about them prematurely falling out like a week after surgery or anything like that. But there's nothing you can kind of do. The body itself will just eventually push it out as a foreign body from the eardrum. Although sometimes what we do get is that when the ear tube falls out, because it's so tiny, it does get lodged with a little bit of earwax in the ear canal. So every now and then when we see kids in the clinic, we see that the ear tube is extruded or come out of the eardrum and is just sitting in the ear canal with some earwax, and then we'll pull it out of the ear canal, just so that way other physicians too can see the eardrum without having a big ball of wax and a plastic tube in the way. But they are supposed to naturally fall out after a certain amount of time.
Okay. And the other question that we have here is, if a child has ear tubes, do they have to cover their ears when they're around water?
So there are some exceptions. Generally speaking, if your child is in shower water, bath water, or we say clean chlorinated pools, don't worry about that too much. So the clean chlorinated pools are treated so that there's not a lot of bacteria in them. Bath water and like shower water is such a short duration of exposure, and generally pretty clean water too, that we don't have to do any ear protection. But we do recommend protecting your child's ears from water exposure if they've had ear tubes, if they are being exposed to more dirty water. And we consider that to be pond, lake, ocean, or water park water. And so if they're in that scenario, you can actually get little ear plugs. And so we have these earplugs that we pass out in the clinic at your first post-op visit. They come in blue or pink, and your child can pick which one they want. Or you can get over-the-counter putty ones that will kind of mold to the shape of your child's ear. So here, there's some putty ones there that you can kind of mash up and put into the ear canal there. And so they kind of just fit, the plastic ones at least, or the silicone ones, just kind of fit into the ear like that. And it helps to prevent water from getting into the ear canal. And then if your child likes to pull them right out as soon as the earplugs go in, there are actually headbands that are designed for that purpose. They go around over the ears so that your child's not pulling out the earplugs.
Okay. So another question here is, what are the potential risks of ear tubes?
So it is the most common procedure performed in children in the United States, anywhere between about 500 to 700,000 a year on average are put in. It's a relatively low risk surgery. But that being said, there are always potential risks for any surgical procedure. So when the ear tube is put in and when it falls out, we have to make a small hole in the eardrum in order for the tube to go in. And then when that falls out, about 99% of the time, like I said, the ear tube or the eardrum can heal behind that tube as it falls out. So there is about a 1 to maybe 2% risk of having a small hole in the eardrum where the ear tube used to sit that may require additional surgery to patch up. And then because we're making an, yep.
Oh, I was just going to ask, if that hole is there in the eardrum, does that present as pain in a child or just general discomfort?
The hole in the eardrum may be completely asymptomatic. Okay. And if we see your child in clinic and we see that there's a small hole in the eardrum, but the tube has just recently fallen out, we may just give it time to heal, because when we do see those holes in the eardrum, about 80% of those may heal on their own with the tincture of time. Okay. But sometimes they do require additional surgery to patch, various techniques on how to do that. But that can then help to close up the hole in the eardrum. The one thing we do want to make sure of is that if your child does have a hole in the eardrum from either a previous infection or tubes or another reason, that we want to check your child's hearing, because the eardrum is very important in helping to amplify sound into the ear. And so if we want to make sure the eardrum is intact for that reason. Another risk of ear tube placement is that you can get skin from the ear canal that gets trapped behind the eardrum, because now you're making a connection between that outside world where the skin is and that space behind the eardrum. And so when skin cells get trapped behind the eardrum, it can form a little skin cyst that we don't want to be there. So if we do notice that at any of your child's follow-up appointments, then we would potentially need another procedure to remove that skin cyst, but that risk is 1 in 1,000, so it's very, very low. And then Like I had mentioned earlier, kids usually outgrow this problem with age, but about 20% of kids who get one set of ear tubes needs a second set of ear tubes. And so that is a potential risk, as well as that, they just continue to have some recurrent ear infections or ear dysfunction.
Okay, great. So those were all the questions we have for now. Again, if we didn't get to yours, or if you're not watching this live, leave your questions in the comments and we'll make sure they're answered. Before I wrap up, I wanted to give you, Dr. Shay, an opportunity to say some closing words to our audience if you have any.
Yeah, so, well, thank you again for having me on the Facebook Live or live Q&A event. I do think it's very helpful for us to be able to talk about ear tubes, because it is such a common thing that I think a lot of people hear about, but don't necessarily kind of know what that is or why their child may need one. And so certainly, if that recommendation has been made by your primary care physician or pediatrician to consider evaluation for ear tubes, we'd be happy to see you. And it's important for us to make sure that your child's ears remain healthy.
Great. Thank you so much. As we say goodbye today, I want to thank Dr. Shay for joining us, and thank you, our audience, for joining us as well. Remember, you can visit us anytime at childrenswi.org for a ton of information, tips, tricks, and more about ear issues and beyond. Thanks again for watching.